Good morning and welcome to the 2018 Inaugural Occupational Therapy and Physical Therapy Nevada State Conference. My name is Dr. Shawn Phipps and I'm the Vice President of the American Occupational Therapy Association. And I'm pleased to join you this morning because interprofessional practice is one of my passions, and I just want to congratulate the leaders and volunteers that helped to make this inaugural conference happen. I'm not sure if this is being done anywhere else in the country, so you all are the trailblazers, and I hope this continues beyond the first year. So I want to talk a little bit about the future direction of healthcare. I want to talk about our vision for our professions as we move forward and how collaborative practice and interprofessional collaboration is more important than ever. We are coming off a centennial celebration in the Occupational Therapy Association. In 2017, we celebrated 100 years of occupational therapy, and I believe physical therapy's centennial is right around the corner. And it was a wonderful celebration of the development of the profession. But obviously, our roots were a bit siloed. We weren't always collaborative in our practice, and the team-based approach really has been emphasized more and more over the last few years as our healthcare system is changing. First of all, we're moving from a volume-based approach to care, where the number of minutes and the more therapy that's delivered is incentivized with our payment systems. We're instead moving towards more of a value-based system where the quality of care is going to be more important than the volume of care. And in this model, interprofessional practice is critical for ensuring that our patients get the highest quality of care, that they get the safest quality of care, and that the entire interprofessional team is on board with advancing the patient's ability to be successful when they discharge from a hospital setting and move throughout the continuum of care. We all have a stake in falls prevention. We all have a stake in reducing readmissions for our patients. We all have a stake in ensuring that our patients have the highest level of independence and quality of life. In fact, as we came off of the centennial, we developed a new vision for the occupational therapy profession called Vision 2025. And that vision is that occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions to facilitate participation in everyday living. And there are four foundational pillars that are emphasized in the development of this vision when we crafted it. And the first is effectiveness, looking at evidence-based, client-centered, and cost-effective care. The second is leadership and being influential in changing health policy, environments, and complex systems. The third is accessibility, making sure that we're providing culturally responsive and customized services to the clients that we serve. And fourth, and more importantly, and especially in the context of this conference, is collaboration, where we are working with clients and within systems to produce effective solutions. And we need occupational therapy practitioners and physical therapy practitioners to be able to work out of their silos for the benefit of the patient. And we all know that what ultimately happens when we're working well together is the highest level of patient-centered care, which puts the patient at the very center. So while we're also looking at a transition from a volume-based approach to care to a value-based approach to care, we're also looking at a moving away from silos of care into more collaborative models. So I want to emphasize a few of the benefits, obviously, of collaboration. And the first is obviously patient-centered care. And the goal for all of us is to ensure that our patients receive the best patient care possible, and that it's easier to achieve with an interprofessional collaborative model instead of having individuals take turns caring for them, sometimes duplicating care that's unnecessary, which drives up costs. We're all familiar with the triple aim of healthcare, which looks at reducing the cost of healthcare, but also ensuring that our patients have the highest quality of care, the best patient experience, and that we are able to actually address population health, which is a huge emphasis that both of our professions are looking at in terms of how do we actually move away from just treating individuals to addressing the needs of communities and populations that we serve, so that we're actually impacting societal need on a much higher level. So patient-centered care is absolutely critical as an outcome of interprofessional practice. And we know that our patients get the best care when we're all working together toward common goals, while we also maintain our distinct value. We each have a unique scope of practice. At the same time, we are able to come together for the benefit of the patient without treating the patient in a silo and not even knowing what the discipline down the hallway might be working on. So I encourage you all to be able to go after this conference, to go back to your practice settings and look at opportunities to really get out of those silos and really enhance the ability to communicate with your interprofessional colleagues, not only in occupational therapy and physical therapy, but also with our other interprofessional team members. That team mentality is so critical, and it really obviously helps us to problem solve much more effectively when we come to the table to discuss the complexity of the challenges that our clients are experiencing, and that we're not working in silos and sometimes stepping over each other in the process. I mentioned that the minimization of readmission rates is a huge focus in healthcare, and by working on collaborative plans for how we're going to reduce falls, how we're going to ensure that our patients actually carry over the skills that they learn in the therapy setting to the environment that they live in. We know that eventually healthcare is going to be moving more towards a home and community based practice emphasis. And even though we've been at this for a long time and we do have home health models, we definitely have a lot of opportunity to improve how we deliver care outside of institutions and address the community needs of the populations that we serve. And a comprehensive patient care plan is there to address all of those things. How do we ensure that for example, the physician's recommendations for care actually get carried out functionally in real life? We all know that a lot of times our patients hear something from a physician in primary care, for example, but don't necessarily carry it over because they don't really have a way of establishing routines around the new methods for how to improve their health and prevent adverse outcomes. I mentioned primary care as a focus, and both of our professions are looking at how do we actually impact primary care in a much more effective way. We've definitely made some strides, but we have a long way to go. This is a perfect setting for us to collaborate as two distinct professions and disciplines, but at the same time addressing those primary care and preventative health strategies for helping our patients be successful in the home and community. And I think the communication gaps that are reduced in an interprofessional model are absolutely key, and it's so exciting that all of you are here. I know from my personal experience, I just celebrated 20 years of practice at Rancho Los Amigos National Rehabilitation Center, where the team-based model has always been emphasized as critical for the best quality patient care. And I'm so lucky to have been a part of a model that was very interprofessional from the time I started as an occupational therapy practitioner in the late 90s. But healthcare has changed tremendously, and the challenges for providing more care at less cost has definitely given us a lot of challenge in terms of how do we manage the complexity, the documentation requirements, and at the same time provide high quality care. These are our challenges, and together we're going to be able to achieve the triple aim much more effectively by working together. So I just want to thank you all again for having me here at your conference remotely. I wish I could actually be there in person. I'm so excited to see this inaugural conference happening, and thank you to the leaders for inviting me to be here to speak to all of you. And feel free to reach out to me. I'm on social media, and you can even talk to the session or the conference coordinators and get some more information about how to contact me should you want to reach out. But have a wonderful conference, and I look forward to hearing about the outstanding outcome of achieving this partners in care approach to collaborative practice. Have a great conference. Thank you so much.